Hi, this is Dr. Eric Thomas speaking for Nutmeg Dermatology, trying to answer questions that we get asked in the office every day. One of the bigger cosmetic questions is regarding fillers. How can we soften these deep nasolabial folds, marionette lines, and it's also used for other purposes. Fillers are used for other purposes, cheeks, lips, and some other areas. It can seem a little confusing, so I'm going to try to put it into two families. One family is a jelly-like material, and the other is a chemical that your muscles produce when you exercise. So the first family consists of hyaluronic acid. Don't worry about the name too much, but there are many brands, and each brand has a subtypes. There's Restylane and Juvederm. Restylane makes a very thin one called Silk, which is good for fine vertical lines around the lips, and there are some others. The particle size is important, and some of them do last a bit longer. So, fairly simple. Clean the skin, talk it over with people, see what they see how we can help them. Then take a fairly small, very small needle and inject the areas to the point where the problem is diminished. As I say, the results are seen immediately, but unfortunately none of this lasts forever. So it varies depending on how quickly a person uses up or metabolizes the material. 6 months plus or minus. Some companies claim a year of some of the newer products. But in any event, none of it is permanent, which in a sense could have some advantages, but still we'd like it to be permanent. It's fairly expensive. About 50% or more of the cost is actually just going right to the manufacturer of the product, which is just the way it is. Then we have another family. Forget about the hyaluronic acid family for a while, and think of one that consists of lactic acid, which is a chemical your muscles produce when you exercise, but in this case the lactic acid has been linked or chained together like a daisy chain, and therefore it affects the tissue differently. The basic way that it works is that it produces more of your own tissue. There's a fibrous tissue that occurs. Unfortunately, it takes 2 months or so for you to see the good results. But the good results last a year, sometimes 2 years. So overall, it's probably a longer lasting product. The other thing you should know is that Sculptra has to be, first of all, wetted or prepared in the office quite a bit before the actual procedure. It's a powder, and it does take a while to properly dissolve. Therefore, if it's done too soon, you could get little bumps or particles, and we try to minimize that by injecting it very carefully. We also inject it a little deeper. We would never use it right near the top of the skin. And then after injecting it, we massage the area and have you do it at home for a few days. And this is to break down any little bumps or particles. Now, if there are little bumps, they're usually not visible. They're deep down below. And of course, they disappear. It's just that they can take a year or two, which is good. So I like to think of Sculptra as that's the brand name for polyl-lactic acid. I like to think of this product as a deeper product that provides a scaffold that may be all that a person needs, but ideally might need a little hyaluronic acid here and there to flesh it out a bit, you might say. These are good products. People are pleased with them. We do a lot of them, but again, it's something you'll have to discuss with your personal dermatologist. So if you have any questions, feel free to send us an email or however you wish to get in touch. We'll try to incorporate it into any future shows that we have. Wishing you best health, hoping that you're careful with the sun. This is Dr. Eric Thomas for Nutmeg Dermatology. Thanks a lot.